Hi, good evening. Thank you, Ross, for a nice and warm introduction. And thank you everyone here and everyone online for being here and taking interest in the management of chronic pain and in acupuncture. Without further ado, I'm going to get started. Okay, so disclosure, I have no conflict of interest with anyone or company. And briefly, we'll go over our plan. We'll first talk about chronic pain, its epidemiology and impact, and then we'll talk about the role of integrative medicine and acupuncture in treating chronic pain in general. And then we're going to dive deep 3,000 years back to China, talk about the history and origin of acupuncture, and then we're going to fly right through the time tunnel and come back to the current, talk about the science and the clinical medicine of acupuncture. Okay, so let's first talk about chronic pain. So according to the International Association for the Study of Pain, pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. And that was coined by Mr. Cohen at 1979, and that definition still persists today. And chronic pain is defined in general as pain that persists beyond 3 months. And right now, chronic pain constitutes a public crisis. Amidst the COVID-19, sometimes people forget people can suffer from multiple conditions. Besides the looming threat of infection, a lot of people in this country suffer from chronic pain. Roughly between 5 to 10% of Americans, or 50 to 100 million Americans, suffer from chronic pain. And out of these, 20 million have high-impact chronic pain, which essentially puts them on disability. And this pain also costs a significant amount of money, and in general, it costs up to $635 billion per annum. So you probably want to ask me next, then what are the major chronic pain types? So here's a brief information. So in this circle here is the overall pain, and the most common one, as you may have guessed, is chronic low back pain, which constitutes 35% of all chronic pain cases. Second to that is arthritis, primarily involving the knee, but as well as the hips and the shoulder. That constitutes 28% of all the pain cases. And third is headaches, which is one of the leading causes for missed work days. And then after that, we composite everything else into one category, or etc., which include total body pain, such as fibromyalgia or complex regional pain syndrome. These are more less common, but still they exert profound impact on the patients and on society. So we treat all of them in our pain center. So the next question then becomes, knowing the impact and prevalence of pain, you would ask me, as a pain expert, what do we do in general to treat a patient with chronic pain when they come to us? What is our thought? How do we analyze them and take care of them? Because of limited time and our focus on acupuncture, I'll just briefly introduce to you our treatment paradigms to our patients. So when we see a patient, we never see them as a disease or headache guy or neuropathy guy. Instead, we try to understand each as a case of a person, and this person has sort of three main concepts. One is biological, your genes, your inflammatory biomarkers, your plasma for the blood center, your blood cell types. But in addition to that, very importantly for chronic pain, the psychological impact of your pain is also important, which can be a result of your blood, your genetics components, etc. And then on top of that layer is is a social layer, which actually interacts with your psychology as well as with your biology. As we all know, you may or may not know that socioeconomic status is one of the major predictors of chronic pain and disability. Many people can work with chronic pain, but a lot of people who become disabled usually have issues with a stable home environment as well as low income and low education. So this is our treatment paradigm. So when we see a patient, we look at the patient from all three aspects, and we treat them from biological, psychological, and help them get onto the social aspect of pain. So from that paradigm, then I want to tell you a little bit more about how does acupuncture and integrative medicine fit in. So once we analyze our patient, then we have sort of a modern, we call them four-pronged approach. The prong one is medications. Classic ones are opiates, which are not necessarily good. But 10 years ago when I was in training, we were actually talking about how we should give more medication to patients. But again, I think now we have seen a big problem. And second is interventions like pain blocks and operations you see in the operating room. And third would be physical therapy, and fourth is pain psychology. So all of this work together, never by themselves. The limitation of even this, the most modern, supposedly the gold standard of treatment paradigm for chronic pain, still have issues in the sense that only limited amount of people respond to each of the categories, and oftentimes the response is not complete. Therefore, there's a real strong need to have something else as an option for the patients. But I want to be very clear with you that acupuncture will not be the solution, but it will be part of the solution. And each person is different. I'll talk to you more about which treatment for which patient later on in our personalized pain medicine approach later in this talk. All right, so let's talk a little bit more about integrative medicine. So again, about 10 years ago when I got my first grant, the Institute of NIH that funded me used to be called the CAM Center, the Complementary and Alternative Medicine Center, and now it's changed its name to Integrative Medicine Center, but they're essentially very similar, right? So CAM is more, it's not the mainstream, it's part of it. Now I think our director is trying to say, actually it is the mainstream. As we're moving forward, it is integrative, it includes everything. So integrative medicine really means it's a focus on the whole person and makes use of all the appropriate therapeutic approaches, including CAM therapies. The reason we like it is because it's patient-centered. It's not about the disease or condition, it's about the patient itself, him or herself. And it's a multi-system. It considers, as we talked about, the biopsychosocial model significantly. And lastly, and importantly, it also integrates other genres of medicine, which have been practiced for thousands of years from other parts of the world, such as Ayurveda, Chinese medicine, Tibetan medicine, and even in Europe, the homeopathic medicine. We integrated everything into our case and trying to develop scientific basis. So we want to take you to a journey that's not only just a traditional history, but also some modern science, as I'll show you next. So here's my favorite part. So growing up in China, I kind of like getting sick. Besides skipping school, I also like getting sick because then I get to check out all the herbal things at the doctor's office. In China, the way we practice medicine is that we not only have the Western one, you take your temperature, they give you a dose of penicillin, but we also have you see a Chinese doctor, take your pulse, and give you herbs and consider acupuncture. So in any case, I've always loved acupuncture, and it's a lot close and dear to me. So the definition of acupuncture came from the Greek. Acus means needles, and puncture means puncture. It came from China, and the first textual record of acupuncture being practiced was from a book written about the Yellow Emperor, who was supposed to be the first emperor who united China. So the book about him came about in 200 BC, but he was actually supposedly alive way before that, in 2700 BC. So in his book, he hired a medical officer, and the medical officer was the one who carried it out, but he, being the emperor, took credit for everything the medical officer did. So this is a picture of him. So again, from the Chinese philosophy, the Chinese acupuncture has been there for thousands of years, but the concept has evolved and grown, but it has been faithful to its principles, philosophical and structural principles. The first part is substance. So the concept of substance, we call them qi, or really translated to English means energy. So you have the energy in the body. It's sort of like a substance, it has to flow somewhere. So we have the concept of meridian. It is conceptualized channels over the body where the energy flow. And typically the meridian connects the outside of the body to the inside organs. So from the Chinese perspective, the energy has to flow in channels without obstruction, when you have obstruction, then there's pathology. And the second important concept is about energy balance. So, of course, you're most familiar with yin and yang, right? The balance between day and night, rest and activity, etc. And also, evolving from that is 5-element theory, representing the earth, the water, the fire, and the metal, and they each represent an organ. But I think that's more detail than you like. Just know that the two treatment principles with Chinese medicine and acupuncture are balance and energy flow. You want everything in balance, you want the qi flow nicely in the meridians. And when something happens to disturb the balance or the qi flow, then there's pathology and pain. And the treatment principle is to invoke balance and unobstruct the obstruction in the qi flow. Here are some traditional pictures. This is energy. It's interesting. It's a Chinese hieroglyphy. On top of that, qi. This is energy, right? On top of that is air, or moving, happy and light. And underneath is rice, which is our primary energy source back then. On the right hand is a meridian. And here's a balance, the yin and yang balance, and 5 elements. All right, so that sums up the basic concept and philosophy of Chinese medicine in a nutshell, and acupuncture. The next question then would be, okay, Dr. Kong, what is the scientific basis? Why should I trust your word that acupuncture might help me in relieving my pain? Can you explain to me in more modern terms that I can understand and relate as a Western person? The answer is yes. Okay, so before we go into pain, I want to give you a little bit of anatomy or pathophysiology of pain and sensory processing. So as you can see here, this is a very much simplified loop of the pain pathways. So it starts with, so this is your dermis, or this is the pain site. Say this is my finger, I jammed into the doorbell, jammed into the door. So when there's a compression, it'll trigger some chemical release right over in a tissue, which is then sends the sensing signal through the peripheral neuron all the way to the spinal cord, the dorsal horn right here. And that dorsal horn is where a lot of interactions can happen. You could have elements such as genetics or inflammation or previous injury, which can cause amplification of the pain signal going upward to the brainstem and the brain, which is finally perceived. Or you could have some descending inhibition through medications or meditations or medications, right? You could meditate to reduce pain, and that has happened. And or other therapies or behavioral therapy or and such, they can actually give you descending inhibition at the same area. So this is a very area of high traffic and lots of control. Similarly, same kind of process, the dual process of facilitation and reduction happens in the brainstem and ultimately in the brain cortex. So acupuncture has been shown to have actions at multiple sites, including the periphery, the spinal cord, as well as the brain cortex. And in addition, it also works in the blood by reducing some blood factors involved with the inflammation and with endorphins, which is a happy pain-reducing chemical in the body. So here's acupuncture site 1, site 2, site 3, and site 4. So here are some nitty-gritties. So if you're interested, I can give my talk as a PDF to the center. They can share it with you. So there are some nice classical studies I'm going to show with you, published in very good journals. The first one was published in Nature back in about 10 years ago by a group out of Rochester. They have found in the periphery, acupuncture helped reducing pain by inhibiting the adenosine receptors. So you can see here, basically this is a pain threshold of the mice that they studied. The pain threshold goes down when they cut their tail or when they inject chemicals in the body. But then as you give acupuncture, you can see the pain threshold went up again, short term, and then it returned a few days later. And so this is just different pain threshold, different chemicals. And over here too, this is the nerve response at the spinal cord level. So you can see that the nerve response to be continually high, but it's reduced with acupuncture Again, short term though, for about 30 to 60 minutes. So immediately when you have received acupuncture, you would have actions in the adenosine receptor in the periphery, which causes blockage of pain transmission. That's step one, published in Nature. Step two is mechanism of acupuncture at the spinal cord level. So as we talked about, the spinal cord is a high traffic area. There's both ascending augmentation of pain signal and descending reduction. And acupuncture has been shown to both reduce the ascending augmentation by reducing the inflammation at the level and augmenting the descending inhibition by triggering release of endorphins in the brain and the spinal cord, which automatically provides descending inhibition through molecular actions. There's some of my work cited here. And there's an experiments we tried to look at acupuncture's effect. So you can see these little waves here represent same uncomfortable. We kind of zap our patient with heat waves over here. Even though the temperature is the same, but the patient reports increasing sensation of pain with the same heat waves right here. And that's one way we can see acupuncture helps kind of reducing this slope of the heat increase. And another very interesting study was done by my colleagues. His name is Dr. Vitaly Napadel, a Russian scientist, now works out of Harvard. So this takes some more explanation. So the brain actually represents, so all your body, everything ends up in the brain, right? So when you have carpal tunnel syndrome, so what that is, do you all know what the carpal tunnel is? So when you type too much, sometimes you have inflammation in the tendons here and compresses on your nerves, your median nerve, which innervates your second and third finger, right? So you can see here on the left top is what normal finger represented in the brain looks like. And bottom of that is when you have carpal tunnel, you can see the representation of the second and third finger become blurred because somehow the nerve's representation is no longer normal. But then after acupuncture, you can see again in the yellow part that the separation becomes normalized just by acupuncture. We call that changes in the neuron connectivity and action neuroplasticity. So for some reason, acupuncture can provide some kind of peripheral stimulation and cause profound changes in the neurons in the brain, and that returns it back to normal. The light blue is the same with healthy control, which does not change. So that's a beautiful study showing how acupuncture causes brain plasticity. Next evidence is about serum cortisol or inflammation and a happy chemical endorphin. So this is another study done in the US about 7 years ago, actually 10 years ago. They provide electrified acupuncture to the knee in patients with knee arthritis. They found that not only the knee pain reduced, furthermore, concordant with the knee pain reduction, they have found that electroacupuncture increases again the serum endorphin levels. So not only in the spine and in the brain, the endorphin or the pain-resistant chemicals, the natural morphines, is also induced by acupuncture in the blood, which explains its immediate strong action upon receiving of the treatment. And secondarily, it also reduces cortisol, which is a stress hormone. It reduces cortisol levels significantly compared to sham or control. So these offered strong molecular and preclinical evidence of acupuncture's mechanisms. And to this day, we're still studying different ways acupuncture can reduce pain. The next question would be then, what do we know from actual patients? These are animals, these are serum studies. What about patients' reported outcomes? So here are some amazing studies. So clinical evidence, again, we're gonna flash back 50 years when acupuncture first came to the States was when in 1972, I think, when James Reston accompanied Kissinger to visit China for the first time. He got diagnosed with appendicitis, probably for eating too much Kung Pao chicken, and he had significant postoperative ileus, which is basically abdominal pain because of bowel blockage. And that was relieved by acupuncture. And then he wrote the op-ed article at New York Times, and that's how acupuncture came to be embraced in the US. And anyhow, 20 years after that, in 1997, NIH from the United States offered a consensus regarding acupuncture. They said the following: we know that acupuncture is clearly efficacious in postoperative pain, postoperative and chemotherapy-induced nausea, as well as dental pain after surgeries. However, we're not sure if acupuncture could work in the following conditions, such as headache, menstrual cramps, tennis elbow, carpal tunnel, fibromyalgia, arthritis, headaches, back pain, post-stroke rehabilitation, addiction, and asthma. Realize out of the 11 conditions NIH needs more studies on, 8 of which are pain conditions. Because it's consensus and announcement, it triggered a huge increase in research regarding acupuncture and pain. In the following slide, here's a jump, exponential jump from 97. However, so there's a lot of studies. I'm not going to bore you with all the details, but many studies were done since that consensus, both in European countries and in the United States. Most of them show a very interesting trend that acupuncture definitely helps reducing pain compared to no acupuncture controls. However, there are some questions regarding if it really helps compared to sham controls. They design sham acupuncture like a placebo control, and there's some issue because you can see this study here done by some of our colleagues in Kaiser Permanente up in Washington State. So this is over here, x-axis is time, y-axis on top is disability, and on bottom is pain intensity. And the first line here you can see is basically usual care. You want low disability. You see some reduction by usual care, so that still works. Medications, rest, exercise. But you can see the following 3 lines here. There's no statistically significant difference between the 3. So two of which are active treatment, one of which is actually sham control. So this study showed it's a bit difficult to separate acupuncture from the controls. And that has been the problem plaguing our community for decades and decades, until in 2012, until this decade, a group called the Acupuncturist Trialist Association from European and Asian countries and US, they decided to amalgamate all the studies on acupuncture, combine them, and do an individual level meta-analysis. You probably know scientifically, if you have enough sample size, you'll see some effect. And they did. And they have proven that acupuncture is helpful in treating multiple pain conditions by combining data from 17,988 patients. And this is the slide right here. So the first one is knee arthritis. Here is a forest plot on meta-analysis. It's a well-done paper published in Journal of Pain. So over here, 0 means no difference between real and control. And over here, the axis on the y-axis is effect size. 0.5 is moderate, 0.7 is excellent, 0.1 is whoa. So you can see that for treating arthritis, the big thing in the bottom is the composite score. It's definitely close to a whoa. So it definitely works great compared to usual care. Yeah. And the next slide is comparing acupuncture in treating migraines and tension headache. Again, it's moderate and pretty good. You just want to focus on the big what do you call that? Quadrangle here. The next slide is combined data on spine pain, the most common one, which is back and neck pain. Again, it's a moderate right over here. And the final one is shoulder pain, and this even stronger for the shoulder pain because this one is controlled against a sham control, and it's clearly superior to sham control, at least a moderate effect. So all of these studies combined, again, over 30 studies on 17,000 patients plus, and they have found that, all right, guys, we have found acupuncture is definitely better than control, sham, or no treatment control. At least moderate treatment effect, if not profoundly good. And because of this, these studies in the last 2 decades have brought real changes in national policies for fee coverage. Here's I'm going to show you. In Europe, so many of the studies cited here were done in Europe. So in Europe is very different. In a way, they're a lot more avant-garde they're a lot less conservative than the US. Most of their primary care physicians and neurosurgeons, they are trained in traditional Chinese acupuncture. And they did a study in early 2000s, and they have discovered acupuncture is so helpful for back pain and for joint pain. They have decided to cover acupuncture, which means you can receive at least 10 free sessions of acupuncture every year if you have diagnosed with normal back pain or knee pain. Headache was sort of part and part because it's not hugely better, it's better, so they wanted more data, but in my opinion it's better because it can help you skip medications. And similar policy are also enacted in other EU countries, including England, France, Greece, Italy, Latvia, Netherlands, Portugal, Spain, Switzerland, and Austria. And Asia has been covered. For example, in China, since I was a kid, it's been covered. However, in the USA, it's a different story. A little bit sad in that it was not recognized by Medicare until this year, in 2020, and it's only recognized by Medicare to treat chronic back pain related conditions. So if you have headaches or knee pain or shoulder pain, you're still not covered by Medicare. So that's a real problem, and that's why we're trying to push our research forward to provide more evidence to help people get the service covered. So the next challenge then, what do you do? So as we see the trend of increasing coverage of acupuncture by national insurances, the next challenge in research beyond efficacy and effectiveness would be to personalize the treatment. So like most pain treatments, not everyone responds to acupuncture. Only about 40 to 60% people respond for various reasons. It could be genetic, it could be psychological. So here are some examples from, here is the US study with 600 receiving acupuncture, different treatments. You can see that about 60%, 50 to 60% responded. The red bar here is placebo control. So you can see there's some response between 50 to 60. Here's a German study. Their routine care had about 30% pain response, and their actual treatment care is between 40 to 50. So again, ballpark 40 to 50% people respond. The next question then becomes, how can you capture or predict the responders prior to initiating the treatment? This will help patient the pain of being stuck, help patient get to the right care quickly, and also help save the healthcare cost. So that's the focus of my grant. We have found some really interesting results that allows prediction better than chance. You can see here, this is the performance of our study. We're writing this paper up right now. It's going to publish soon, hopefully. So this is performance of chance, and we can see here we perform definitely better than chance. We're about 70% to 76% based on the treatment type. The goal is to reach 80%, so we clearly still have ways to go. But this is, as far as we know, the first effort in predicting clinical response to acupuncture using behavioral biomarkers. Over here are the behavioral biomarkers. These include fear avoidance, BMI, body mass index, sleep disturbance and anxiety. Interestingly, if you are older, if you have sleep disturbance and anxiety, actually you're more likely to respond to acupuncture. I think this study will be helpful for Medicare people and the policy makers, because then if you see these comorbidities recorded in patient's chart, then I think they should be more easily covered by acupuncture for their pain conditions. So anyhow, we're looking to publish this data in the very near future. Okay, the next one will be, how's my time? Time is good? I think we may actually finish early. We're getting to the last part now. The last part is regarding practical considerations. So I guess as the audience here, some of you guys may have back pain or headache or neck pain or knee pain, shoulder pain. So if you want to get acupuncture service, what are some of the things you should think about? The first one is typical treatment parameters. The duration of the treatment is typically about half an hour to an hour. You usually, again, depends on the patient, the participant, the provider's style. The Chinese acupuncture tend to use fewer needles, but very strong technique, strong stimulation. Whereas if you're Japanese practitioner, Japanese style acupuncture, they tend to use more needles, but less stimulation, less painful. And typically, we tend to prescribe about 5 to 10 sessions. And I would say if you don't respond after the first 4 to 5 sessions, the chance that you'll respond is pretty much reduced to a lot less. And ideally, when you start treatment, you probably should have at least one a week, ideally 2 per week. And the cost really ranges depending on where you are and who you see, and also if they accept insurance. It ranges between $50 to $200. Typically, it's more about $85 to $100 range. And another important concern for patients is they would ask me often is, what is the safety? How safe is acupuncture? The answer is it's in general a very safe procedure. It does have side effects, but these are very common and they're self-limited. The most common one is needle site pain, which happens immediately but it goes away right after the treatment. Minor bleeding and small hematoma, small bruises from intense manipulation. But again, these are small amount and self-limited. The serious ones do occur, but they really occur in frequencies in less than 1 in 1 million, which is actually a very low number compared to surgery complications and medication and other things. So the complications from acupuncture can include pneumothorax, pericardial tamponade, bleeding around the heart, which is not good, or major nerve injury, sciatic nerve injury. These can happen, but it not happens here very much because most people in this country are more conservative in terms of treatment and the manipulation. So once you receive a treatment session, for example, what to expect, typically you can receive pain relief right away in majority of patients, but some patients it may take a few sessions to really see benefits. And the pain relief and the really good relaxed feeling from the endorphins, endogenous morphine and the happy chemicals will last 2 to 3 days. And that's why it's important to do 2 or 3 times a week so you can sort of stack up the benefits over time. Once you reach that nice threshold, you'll have significant reduction of your pain. I had patients who had profound facial pain from trigeminal neuralgia that pretty much just recovered from a few sessions. So it does happen. And then, as I mentioned earlier, based on our study, if you don't respond after 4 sessions, the chance to respond in future sessions, actually more sessions, is pretty low. All right. Where to find acupuncture service, as Mr. Ross mentioned earlier, we do offer that, and I'm the acupuncturist at the Pain Center. Currently, because of my research commitments, I'm not there very often. The COVID also have stopped our service, but I do offer that. On the pediatric side, my colleague, Dr. Brenda Coliano, she's just like me. We're board certified in acupuncture, anesthesia, and pain management. And in the Bay Area, there are some very nice schools. They offer reduced fee service to patients with Medi-Cal, for example. They also offer a lot of philanthropic service to communities, vulnerable communities like HIV population, homeless, particularly at ACTCM. They're a wonderful institute with great funding. If you're within the US, there are some websites you can log into for you to find practitioners in your area. Within the USA, there's MD practitioners or non-MD practitioners. So these are all certified organizations. So for us to practice, we have to pass our exams in the respective area and carry a license. So you want to go through these areas because these are more official certificates. So summary, so chronic pain represents a public health crisis. Less obvious because of COVID, but it is present and brings profound cost to society and the individual. And we typically use a multimodal approach, using biopsychosocial approach to analyze the patient and provide multimodal treatments, recommendations including medications, injections, PT, psychology. And I'm here to tell you that acupuncture can be a great adjunct to that. You can integrate that anytime during your treatment course, and I think it'd be wonderful to help you feel better. And as I mentioned earlier in the talk, there are a lot of profound evidence supporting acupuncture's use, both in animals and humans with clinical pain conditions. For one thing, take-home message, acupuncture is effective in treating knee pain, profound evidence, back pain, profound evidence, and neck pain, as well as shoulder pain and headaches. Is a little bit less, but headaches is still, if you respond, it's profound response. And last but not least, it's generally safe and affordable. And so at the pain center, we carry out both patient care and some scientific studies with minimal disturbance to the patient. You're welcome to come and talk to me about it if you're interested in participating. And that's that. I want to acknowledge support from National Institute of Health who support our study in acupuncture and pain management, where I work at Stanford Division of Pain Medicine. I practice pain medicine and acupuncture and research, and out of Society of Acupuncture Research, which is international collaboration of friends and colleagues interested in researching acupuncture and cultivate friendship and support in its study. So thank you again, Ross and the Blood Center and Jen and the crew. And I think we're done and we're open for questions.
We do. Dr. Kong, thank you so much for your time in that presentation. It was fantastic. We've got some questions coming in online. First, Bob asks, what have you seen with acupuncture relieving L5 area stenosis pain? If effective, how long does the relief last?
I think this is a very good question, Bob. First of all, we have to establish, sometimes as a pain doctor, you see that there's a big disconnect between patient's pain complaint and actual MRI. So first we have to establish the L5 stenosis indeed contributing to your pain, because sometimes the back pain can also come from arthritis and from myofascial pain. If these are the source, definitely it'll respond to acupuncture. But if your pain is definitely for sure 100% coming from the stenosis, which has a different characteristic, which is worse when you walk and it goes sort of in the sacral area going down your leg, I think epidural is a better choice.
Our next question is from Gregory, who asks, how does cupping help reduce pain?
Fantastic question. Thank you, Greg. So, so cupping is great, particularly for myofascial pain and sometimes emotional pain. Oftentimes, as you practice I've been practicing for over a decade. When you have a lot of chronic pain, oftentimes it's a combination of genetic factors, environmental factors, and trauma. So when you have pain which is worsened by emotional stress and situational stress, they usually have myofascial tenderness, and because of tension and emotional response, those respond really well to cupping. So cupping moves really the muscle, and in Chinese terms, the meridians, the key meridians are reflected on the back. So it works great, and usually again works right away, lasts for a few days. It's not as profound as needling, but it does help, particularly if you have myofascial pain, neck pain, shoulder pain, and back pain. There's a good chance to respond well to cupping.
Terrific. Our next question comes from Juan. Acupuncture is a medical art. How important are the different techniques, and which one is most effective?
That is a great question, Juan. Unfortunately, I want to be as scientifically based as possible. So first of all, acknowledging his observation that there are definitely lots of different regimes of practice. The most well-studied, however, is traditional Chinese. We call it TCM acupuncture. So most of the studies are done on TCM with or without electrical stimulation. However, there are related techniques such as ear needles. There's Korean acupuncture, for example. They're delicate. They put needles in the hand because, again, the idea of microsystems that your body is represented on your hand. For the cupping, is your body represented on your back. So it's different ways of representing yourself. Or feet. So, and Japanese is more palpation in the abdomen. Your body's in your abdomen. So, but studies on these are less common. At least by the Western European countries. There are some studies, I think, in Korea and in China on some of the less common systems, but the evidence base is less, so I can't really say much.
Our next question comes from Carol. Our daughter had acupuncture in South Korea with a flame on top. Does anyone do that here, and what specialty should we look at?
It's interesting. I love it. I have an anecdote that's related to Carol's story. When I was in China, when we actually organized a conference in China with our society, we would visit our colleagues, and they are definitely more intense. besides the flame needles, they even also have these little lancets. They put lancets and have the patient sort of bleed a little bit. So for depression and things. I think for the flame needle, it's great for we call heat syndromes. If you have like skin conditions or acute cold, they can do the flame. But these are kind of traditional hardcore oriental approaches, which you have to ask the doctors. Typically, if you ask, maybe ethnic doctor, they do that. But most sort of American practice, we have a lot of people from different ethnicity practice, a lot of Caucasian, a lot of African American and Hispanic practitioners. Those are trained more Western, a little more gentle. The kind of hardcore flame needle and lancets approach is rare. But dermatology maybe, yeah.
Apologies. Our next question comes from Ola, who asked, what will it take to get U.S. healthcare up to date on coverage for acupuncture?
I think that's a profound question. I don't mean to be political, but what would it take to take care of the Black Lives Matter? It's all related because this country is all profit driven. In this country, surgery, we know it doesn't work. We know it actually causes harm. Fusion surgery for axial back pain, but it's still being supported and paid for because of lobbying, because of big money and pharma. And we know acupuncture works better than NSAIDs, but medication still sells more. I think it has to do with politics. And unless there is sort of a more governmental and more sort of a forceful approach like the European countries, I think it'll be hard. We are in our society of acupuncture researchers, we try to push with the policies and things, but I think in this country, money talks. Without money, I think it's going to be, we just have to see how it goes. I think maybe with the opioid crisis, even guys, I'm kind of passionate about this because it's my cause, right? Without the opioid crisis, Medicare wouldn't have even thought about acupuncture. It would still be in the back seat. We only came about because of the opioid crisis, because of the HEAL grant. So hopefully we can move forward with more evidence. Thank you.
Our next question comes from Nancy. Could you discuss fibromyalgia, what that entails?
Yeah, it's we can briefly discuss. I'm happy to talk to you more about that offline. It's a complex condition. It affects about 1 to 5% of the general population, and is primarily women. 90% are women, and it happens anytime in your life between teenage all the way to your 50s. That's the most common onset. And we are trying to it's a very profound condition. It affects the total body. You usually present with total body pain, along with fatigue and profoundly impaired sleep. As a comorbidity, because of these conditions, pain and sleep impairment, people often present with comorbid mood problems such as depression and anxiety. And the treatment involves a three-pronged approach using FDA-approved medications, Lyrica, Cymbalta, and milnacipran. But and also you need to do PT and psychology and warm bath. One interesting thing from Oriental perspective, there's some evidence of acupuncture, but what actually helps even more with multiple studies published in the New England Journal of Medicine, which is our best journal, is actually Tai Chi. So it's a Chinese mind-body therapy where you do slow, measured movement with meditation and breathing. And that one has been shown to be extremely effective for fibromyalgia. Something to check out.
A follow-up question from Ola. I find that acupuncture hurts more now with neuropathy. Does this cause avoidance?
That's a good question. As I said in one of the slides, acupuncture doesn't work for everyone, and we're trying to figure out what are the factors decide who responds. And I think with neuropathy, it can hurt more. You need to, at the same time, however, in order for acupuncture to work, it doesn't have to be needled right at where you have pain. Based on the meridians and balance theories I discussed earlier, you can try different acupuncturists, for example, and try to have them place needles elsewhere in the body and help you recover. So I wouldn't avoid to Ola, just follow up with her. You can try a different approach, a distal approach away from the painful site.
Next question comes from Janet. Anything for peripheral neuropathy in the feet?
That's a great question. I have to confess, this is one of the harder conditions to treat because not much evidence, only small clinical studies. In my hand, I find it pretty challenging in the peripheral. Usually these are long-standing conditions. I think what would be helpful is maybe combining acupuncture with medications and interventions. Just by itself, I think, again, based on the evidence and my own personal experience, it's more challenging to treat just by acupuncture.
We have a follow-up question from Gregory. Does Stanford Pain Management Center offer acupuncture and cupping?
We offer acupuncture but no cupping. And right now, because of COVID, the service is on hold, unfortunately. If you want, I'm happy to provide some referrals. Yeah, but we do normally offer acupuncture service, and I'm already expanding our service to include additional providers.
Juan asked about training resources.
Oh, I'm sorry I forgot to put that in. So there are training resources. The one I trained in was this thing called Dr. Joseph Helms. So he's a legend in our field, talking about stories. Dr. Helms is an amazing guy. He is a professor of emergency medicine from UCLA. But in his youth, he visited France. But that's when there's a revolution. I think there was social unrest. So instead of working in medical school, he taught himself acupuncture with a classical French acupuncturist. And he brought that back. He called them, so actually I learned French. Me being Chinese, I actually learned French acupuncture. So his name, so look up for Juan, jot this down, Juan, Joseph Helms, H-E-L-M-S. Look up Helms Medical Institute. Another one is called the 5 Elements. These are good hands-on ones. There's one from Harvard, but it's more cerebral. You don't have much of a hands-on practice. I like Dr. Helms and 5 Elements.
Our final question from Richard. I have chronic back pain. If I'm a new patient with acupuncture, how many treatments do I have to do to find relief?
I think, again, we talk about depends on what it comes from, right? It's a very complex condition, the back pain. I think if it's from arthritis and chronic muscle injury, maybe 3 to 4 sessions you'll see benefits right away, even from the first session. I've seen that a lot. However, as one of the person asked earlier, if you have true spinal stenosis related pain due to actual narrowing of your spinal canal, then I think for that condition, the best treatment would be epidural and maybe minor surgery to reduce that canal diameter.
You want to let the viewers know where to go for the Stanford Pain Management Center, the website?
Yeah, give me a second.
And where they can find more information?
Yeah, absolutely. Give me a second. Let me go to the web. I may need some help. Okay, I think we're on the Google. If you just look at Stanford Pain Management Center, you will see. I don't know how to work your computer here. Sorry. Could you give me a hand?
We'll put that link up for you.
Okay, perfect. Perfect.
We have one last question, that just came in. Any possible help for osteoporosis?
I think if you have pain associated with that, absolutely yes. But the source of osteoporosis is because lack of calcium in the bone, right? So you need to speak with an endocrinologist. So the thing, in terms of our treatment principle, is always patient-centered care. I like to work with my patient and have them take the driver's seat. I'll be the coach, which means you need to make sure you do the weight-bearing exercise, right? You take the right supplements, see the endocrinologist and make sure there's something, hormones all taken care of, and then we can do acupuncture to take care of the symptoms. But for osteoporosis, you have to treat osteoporosis first with activity and medications.
Thank you so much, Dr. Kong. We really appreciate your time, and that was a terrific presentation.
Well, thank you very much. I enjoyed. So peace to you all.
And thank you for everybody for tuning in tonight, our first virtual Cafe Sci. Our next event will be scheduled for August 6th. We hope to see you then. Have a good night.